We are presenting the results from our research on the effectiveness of magnetic resonance guided radiotherapy versus image guided radiotherapy in head and neck cancers. In treating head and neck cancers, sparing organs at risk and controlling tumor volume changes have always presented a challenge for traditional linacs. However, V-Ray software allows for the delivery of personalized and adaptive radiation therapy. This improves the accuracy of the targeting the tumor and avoids dosage to organs at risk. While treating the tumor, organs can be observed, which allows for the tracking of dose and allows us to stop treatment when dosage is out of the treatment range. Due to the control that we have with MSGRT, there's an improvement with tumor control and reduction of side effects. The major difference between traditional linacs and the MRI linacs is they're moving for imaging from CT to MRI technology combined with a linear accelerator. This allows for better tumor visualization during the treatment processes. MRI-guided radiotherapy is a relatively new modality in the radiation therapy field. However, we were able to obtain information by searching the Wayne State Library and Google Scholar and their medical databases. From there, we found some articles, studies, and journals and picked the ones that were most relevant to our research and compared them to each other. Cumulative dose to the parotid glands is grossly underestimated in situations where treatment adaptation is not feasible. The image shown is from an MR linac. The red circles indicate a decrease in size of the parotid glands by 8.2 cc's and the other by 10.2 cc's. The distance between each parotid gland also changed from 11 centimeters to 10.3 centimeters. The ability to catch these changes in critical structures is important because overdosing can cause toxic effects such as xerostomia in head and neck patients. The image on the right is showing the numerous recontoured parotid glands for each fraction based on how they change throughout treatment. The graph on the top right depicts how the treatment was delivered. As you can witness, when changes in the volume of structures occur, alterations in treatment happens as well. Some of the benefits of MR-guided radiation therapy that we found in our research were a better soft tissue imaging as opposed to CBCTs, the software for the V-Ray, and their personalized and adaptive radiation therapy for each day of treatment, avoiding of high dosage for critical structures, also allows for the tracking of the delivered doses, and also allows the treatment to be stopped when the conditions are not good for the treatment. Tumor control and side effects were also seen to be improved in head and neck patients. Despite the revolutionary benefits, MR linacs do not come without some challenges that must be addressed. Some of the issues relate to time, training, and cost. MR linac treatment time simulation is considerably longer compared to that of traditional linear accelerators. Traditional time slots for radiation therapy appointments typically are about 15 minutes, while MR linac treatment time slots can take an hour. This results in more uncomfortable treatments for patients as well as clinical sites not being able to take in as many patients. Also, running an MR linac requires additional training for a radiation therapist. Not every therapist in any given clinical site will be able to operate it. Clinical sites must allocate time to train or hire new therapists. Cost is also an issue. Insurance companies are not entirely convinced of the added clinical value of MR in linear accelerators. In certain cancers, there is no evidence that MR-GRT treatment is substantially more effective than traditional IGRT. Insurance companies lack the willingness to pay for this, and it makes it difficult for patients to utilize its benefits and for clinical sites to offer it. Although using an MR linac for a patient receiving head and neck treatments would be more beneficial to the patient, one area that is still lacking for this type of treatment is immobilization devices. This complication comes into play due to the challenge of keeping the patient comfortable during their longer treatment times, the hearing protection for the patient that needs to be used, the smaller gantry size, and the need to include the MRI coils. As of right now, the thermoplastic masks that are used for traditional radiation treatments are being used, and the institutions are coming up with their own form of immobilization devices to use, but as the advancements continue with this form of treatment, immobilization devices for head and neck cases need to be researched further. To sum it all, while linac treatments and MR linac are both advantageous in treating cancer tumors and sparing health tissues around the tumor, they each have their challenges within the healthcare system. Although LINAC treatments offer shorter duration of treatment, the MR gives better views of tissues and live monitoring of tumor, but that comes at risk with the patient's comfort as the MR treatment takes long. Some limitations to the studies is that not every patient is a candidate for MR treatments due to the possible anxiety, phobias, etc., due to the small size of the gantry. For future research, studies can be conducted with possible other immobilizations that can be more comfortable for patients and can adjust the comfort of being treated with the MR LINAC in long durations of time.